So you've been diagnosed with ankylosing spondylitis. Your rheumatologist has recommended that you take a fairly strong medication, a biologic medication, should you be concerned. Hello, this is Dr. Siddharth Ambar, physician at Chicago Arthritis and Regenerative Medicine, expert in rheumatology and regenerative medicine. When you get diagnosed with an autoimmune condition, ankylosing spondylitis being an example, frequently your physician, a board-certified rheumatologist, should be managing it, and frequently they will recommend medication to control your condition. And frequently those medications are immunosuppressants, meaning you have an autoimmune condition where your immune system, normally meant to protect you from bacteria and viruses, is now miscommunicating and now attacking your own body. So we don't have an easy on and off switch for the immune system. What we have are medications that help to settle things down, to basically prevent that overreaction. Now, people always get concerned when they hear about medication, and that is appropriate. Medications can have potential side effects. Now, if you can control your autoimmune condition with conservative measures, meaning diet, exercise, lifestyle factors, supplements, any other modality outside of medical treatment, such as medications, then absolutely go ahead and do that. If you have a really, really mild autoimmune condition, that's possible. But for everything else, there's a lot of risk in not trying to control your immune system. And the risk is that your condition can progress. In a condition like ankylosing spondylitis, the risk is that there is progressive inflammation, in particular in the spine, that can then lead to progressive damage, deformities, pain, disability affecting the spine. In reality, ankylosing spondylitis can affect multiple other areas as well, including your peripheral joints and tendons, and even your cardiovascular system, the eyes. There's associations with ankylosing spondylitis and other types of autoimmune conditions as well. So it's not a benign condition. And in autoimmune conditions where if you are at significant risk for progression, the balance of what are the potential side effects versus what is the potential for progression generally weighs to the benefit of treatment to prevent that progression and to control your condition so that you can live as close to as possible a healthy and normal lifestyle. So absolutely, you should always be concerned when your physician has recommended medication, whether it's for ankylosing spondylitis, another autoimmune condition, or frankly, any medical condition. But as long as you're aware of what is the natural course of this condition that I'm dealing with, what is the risk if I don't do treatment, what is your risk of progression? And in autoimmune conditions, we have some sense of that, frequently very accurately. And what are my range of treatment options and what are the risks? And then at least understand why you're being recommended treatment. Proceeding with treatment for your ankylosing spondylitis or autoimmune condition is appropriate and can be managed safely with a trained and considered rheumatologist.